Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition plantar fasciitis. So, plantar fasciitis is an overuse injury of the plantar fascia characterized by mid-heel pain and can radiate toward the toes. Okay? The most common cause of foot pain in athletes, which occurs due to overuse and stress on the plantar fascia, which can result in tissue fatigue and micro-tearing at the calcaneal attachments. Okay, it's somewhere on the heel bone. Okay, so the person with plantar fasciitis is usually over 40 years of age. However, very active athletes may experience symptoms as early as 20 years of age. There is gradual onset, and on acute stage, there's new, nearly intolerable pain. And on chronic stage, there is following acute, symptoms more bearable, and the duration of this condition is usually no more than 1 year. So more prevalent in those who participate in high impact sports or after increasing the intensity of an exercise program. So greater risk in people with pes cavus, which is high arch, pes planus, which has low arch, excessive foot pronation, and increased inversion or eversion. This is more on the foot. Okay, so occurrence of this condition usually unilateral, meaning on one side, and can also be bilateral, meaning on both sides. Okay, so causes of the condition: there's an overuse due to overtraining, poor technique, running or hard surfaces, or prolonged standing and activities that require ankle plantar flexion and simultaneous extension of the metatarsophalangeal joints. It's on the foot, such as running and dancing. The predisposing factors. Okay, there's poor biomechanics such as excessive pronation or supination of the subtalar joint or excessive internal rotation of the hip joint while walking. Okay, there's short and tight gastrocnemius and soleus muscles, the calf muscles, and the soleus, which is on the posterior lower leg, which predispose the foot to pronation. Okay, improper footwear that is worn out, too flexible, too stiff, or does not provide adequate arch support. Okay, there's weight gain, including pregnancy, which stresses the plantar fascia. The symptoms. Okay, the symptoms range from mild to severe. Okay, guys, so the pain has an initial slow onset with no history of injury or trauma. Okay, so presence of edema, which is swelling, is rare in some cases, but swelling is present especially with pes cavus or pes cavus foot. Okay, pes cavus, which means high arch on the foot. The pain occurs with the first few steps after non-weight bearing. Okay, so the symptoms are worse during the pre-swing phase of the gait cycle, which is the walking cycle, during stair climbing. Okay, so during stair climbing, when you climb the stairs, the pain lessens after 30 to 45 minutes of activity. Okay, then intensifies again with 2 or 3 hours later with continued activity. Okay, it is usually relieved by rest. So just resting, guys. The condition will be relieved. Okay, so the pain is usually located on the anteroinferior surface of the calcaneus on weight bearing. Okay, so it's the anterior, the front side, inferior, the bottom side of the foot. Okay, that's what it means, anteroinferior surface. Okay, it is also extended. It may also extend along the medial border of the plantar fascia, medial border, meaning on the middle area or middle side, of plantar fascia towards the metatarsal heads. Okay, so metatarsal heads, that's where the, the head of the metatarsal, the in the middle of the foot. It's found in the middle of the foot. Okay. Paresthesia may be present on compression of the medial longitudinal arch. Okay, so paresthesia, there's nerve problem. Okay, so there is pes planus low arch, pes cavus high arch, and Achilles tendinitis. So inflammation of the tendon of the Achilles tendon, are often present. So these three guys, you will see as symptoms of somebody who has a problem of plantar fasciitis. Okay, so with repeated stress, a bone spur may develop on the medial aspect of the calcaneus. So here you go, guys. There will be a bone spur on the calcaneus, like in between, just the interior part of the calcaneus, calcaneal bone. Okay, the heel bone, right? So tension is placed on the plantar fascia with repeated use. So there you go, guys. So you'll feel tension on the plantar fascia with repeated use. Okay. So that is the part one of the treatment plan, which gives you the definition in the causes and symptoms of the condition. Okay, so we move on to the part two, which is the subjective component. Okay, so on the subjective component, you'll find the health history questions. So these are the questions that you may ask your client when you are treating for plantar fasciitis condition. So one is there any history or injury to the foot? Okay. Next is the client's first few steps in the morning painful? So is the client's first few steps in the morning painful? So you're gonna ask this question to your client as well. So has the client seen a physician for a diagnosis? So you're gonna ask your client with this question as well. Is the client currently taking any medications? Okay, you ask if he or she is taking medications. What type and for what reason? So what type of medication and for what reason is your client taking the medication? Okay, so how long has the client been experiencing the discomfort? Okay, a discomfort of this plantar fasciitis condition. So you're gonna ask all these questions, guys. It will help you with the assessment in this kind of problem when you during your treatment with treatment plan for your client having this problem. Okay, so let's move on to the part three of the treatment plan, which is the objective component. So this includes your assessments. So with the assessment, you're gonna do observations, which is a postural assessment is performed. Okay, during observations, you're gonna perform a postural assessment and noting excessive pronation and signs of swelling. So signs of swelling in the medial longitudinal arch. Okay, so it's the plantar area of your foot in the middle. Okay, so gait is observed. Gait means the walking of the client, how the client walks. Okay, so pain is reported as worse during the pre-swing, which is the toe off stage of the gait of the walking phase. Okay, there may be excessive external rotation of the hip during the gait or the walking phase, or there is abducted gait. Okay, this is abnormal. There's an abnormal walking. Okay, for the gait assessment or the walking phase or walking assessment, just read on this information, guys. Okay, And for the, you're gonna do palpation in range of motion, ROM. Okay, so just read on this information, guys. Additional for palpation and range of motion. Just read on that. Okay, for testing, you're gonna test for active and passive extension of the metatarsophalangeal joints if it's painful due to stretching of the plantar fascia and the intrinsic foot muscles. Okay, so the length test as well for gastrocnemius and soleus will reveal shortness. Okay, so active resisted testing, and it will include hopping on the affected forefoot to reproduce the pain. Okay, so weak intrinsic foot muscles may be present. Intrinsic meaning in the inside of the foot may be present. Okay. Okay, so for the contraindications and precautions, so with with the condition plantar fasciitis, you will be noting that the friction technique frictions are avoided if there's acute inflammation. Okay, if the acute inflammation is present. So if the client is taking anti-inflammatories, so medications, or if the client has a history of repeated corticosteroid injections to the plantar fascia. So you have to be mindful of these contraindications and precautions, guys, when you are treating a client with a problem of plantar fasciitis or fasciitis. Okay, so let's move on to the part 5 of the treatment plan, which is the treatment plan. So your goal on this on part 5 for your treatment plan should include massage treatment is in the context of a half hour relaxation massage. Okay, guys, so it's just a half hour relaxation massage, and it should include diaphragmatic breathing. Okay, you're gonna ask your client to take a deep breath, take a deep breath in, and take a deep breath out. Okay, so diaphragmatic breathing. So that is your goal in this in the treatment of this condition. So for the positioning or the pillowing or draping and techniques, so during an acute stage, positioning is prone at first. Okay, so prone meaning face down or on the client's abdomen. Okay, face down on the table to reach the compensating structures. So you're gonna do the face down or prone position so you can treat the compensating structures, which are the structures that are indirectly affected by the condition. Okay, so these are the structures or muscle tissues, tendons, ligaments. These are the ones that do the actions or the movements when the affected area cannot perform its action. Okay, so the pillows are placed under the abdomen, okay, under the stomach, and ankles under the ankle. Okay, so the ankles, that's where you place your pillow. Okay, so during chronic stage, positioning is the same as for the acute stage, so it's same. Acute and chronic stage, the positioning is the same as well. Okay, for the hydrotherapy, so this is a use of cold or hot water therapy for the condition. So during acute stage, hydrotherapy is cold application. So you're gonna use cold compress or ice pack or cold pack on acute stage. So usually an ice pack or the onto the affected fascia. Okay. Next is you have to have cold packs. Yeah, like I said, ready to treat the acute stage, in moist, warm packs, ready for the chronic stage. Okay, so cold packs for the acute stage and warm packs for the chronic stage. Okay, so the hydrotherapy application is deep moist heat, okay, before stretching the fascia of the gastrocnemius and soleus muscles. So gastrocnemius and soleus, where your these are your calf muscles located on the back of your lower leg. Okay, so a contrast application is used after treatment to increase local circulation, meaning you're gonna do next. So contrast means you're gonna start with a warm application, warm hydrotherapy application, and then followed by cold hydrotherapy application, and so on and so forth. So you start with warm and you end with cold application. Okay, so this would increase local circulation, meaning the blood circulation and the lymph circulation on locally, on the area, the affected area. Okay, and on chronic, which is, it's been there for a long time, the hydrotherapy application is deep moist heat, and that's before stretching the fascia of the gastrocnemius and soleus muscles, which is your calf muscle. Okay, a contrast application is used after treatment to increase local circulation. So same thing for acute and chronic, you're gonna use contrast application, use of warm hydrotherapy application and cold hydrotherapy application, and vice versa. So you start with warm application, then end with cold application. So this is for application during chronic stage as well. And it will also, this is done to increase local circulation. Okay. So for the general treatment of this condition, preventing a recurrence includes moderating the exercise program. So there is moderation of the exercise program, maintaining ideal body weight, okay, wearing supportive shoes, stretching before and after exercise, and performing foot and ankle exercises to maintain strength and flexibility. So this is your general treatment, for this condition. So you're going to consider this as a general treatment. Okay, so for specific treatment of the condition, so specific means on a specific time or stage. So for acute stage, you're gonna do all these techniques. So just read on this, okay? For the chronic stage, just follow this treatment. Just read on this, guys. Continuation, just read on this for the chronic stage. Now let's move on to part 6, which is the self-care plan for this condition. Okay, so during acute stage, the client is instructed to rest. Okay, no weight bearing if the plantar fasciitis is severe. Okay, so you instruct your client to take a rest. Okay, use ice and elevate the affected foot as much as possible. Okay, so here you go, guys, for acute stage usually. Okay, these are what you're going to do. Okay, now for the chronic stage, the client should rest from aggravating activities. Okay, so excessive exercises, any activities that can increase the the problem, the pain on the condition, okay, on the area. Return to activity is gradual, beginning with non-weight bearing activities such as swimming or bicycling. Okay, ice is applied 3 or 4 times per day to control the inflammation and after activities that cause pain. Okay, so there are more information here. Just read on this, guys. Okay. Okay, just take a look at this information for chronic stage. Okay, so next is the treatment frequency. So how often you're gonna do the treatment for a client with this problem. Okay, so in the acute stage, you're gonna do acute stage the first 7 days of the occurrence of the condition. Okay, so you're gonna do a 30 minutes session directly on the foot twice a week. Okay, guys, so twice a week, 30 minutes on the foot, directly on the foot. Okay, it will be followed immediately by another 30 minutes of work to compensating structures or for relaxation. Okay, so compensating structures, guys, like I mentioned, will be those structures that are indirectly affected by this condition. These are the structures that work for the muscles or other tissues that cannot function with their actions because of this condition. So the surrounding structures will be compensating, working for this, to do the movements of these muscles affected by this condition. Okay, so in the chronic stage, which is chronic means it's the condition has been there for for a long time, maybe 6 months or more. Okay, so you're gonna do a 60 minutes massage or treatment session once a week until the pain is completely managed. Okay, and you can also do 60 minutes session every other week as the pain lessens and the client takes on the responsibility of daily self-care. Okay, so a 60-minute monthly maintenance session as well. Okay, so you're gonna start with 60 minutes once a week, and then you're gonna do followed by a 60-minute session every other week, and then you're gonna do another 60-minute session once a month for just maintenance. Okay, maintenance treatment for the condition. Now, for the expected outcomes with the treatment of this condition, so most patients who receive appropriate and prompt care will respond to conservative treatment. Okay, so the first step is rest. So resting, guys. Okay, that's the first step. The offending impact of the plantar surface of the foot must be relieved if healing is to begin. Okay, guys, so this is a treatment plan for the condition plantar fasciitis. So thank you for watching my video, guys, and please subscribe, like, comment, and share this video. And again, thank you, and you have a great day.